Hi, Samantha. So, look, here are some thoughts on your project as I understand it right now. Now, this may not be how you understand it, but that's okay. I just want to go through some of the issues that I think might be pertinent to what you're doing. So, your big research question is how does Henry Ford Hospital, and I think that's where you're working, wherever you're working, how does it teach and assess the ACGME core competencies and milestones through patient simulations? I think overall the objective is to study the process of training assessment. That is, what and how it was taught and not the outcome. That one of the things that you don't want to study here is whether or not whatever they uh, were taught through simulations was actually learned. That's a whole separate thing. But basically, you're studying the process of training and assessing skills, and not whether it worked or not. Now, why is this study important? Um, I think the core competencies and the milestones have required skills, and I'm underlining this because by this I mean observable behaviors that residents are to master and demonstrate. Um, there are other things such as medical knowledge, which is not so much a skill; it's what you know, and it's best assessed through, for example, multiple choice testing, that sort of thing. But here you're really focusing on skills, something that can be seen and measured through simulations, and arguably, I think such skills can be taught and assessed through different types of patient simulations because of the control of the learning and assessment process or environment they afford. That's one of the big reasons we do simulations, is that you can control learning. You can have patients, simulated patients show up as needed. If you need a patient who's in heart failure, you don't have to wait around for an actual patient in a hospital. You can produce it on schedule. So you can argue this, and it's been well argued in the literature. Um, and also, I think, moving on, I think it also will reveal how simulations are used at your place. They could suggest how they might be used if they're not being used. Probably after you do the study, you can make some suggestions how they could improve their training and assessment of skills process by incorporating simulations. And I think it's also important because you can inform other residency programs of the possibilities of using Sims to teach and assess the core competencies and milestones. And also, we talked about one of your goals is to perhaps consult with other programs on this process. So I think going through this process will just help you understand how uh, these simulations are used or not used in various residency programs. So when we're talking about simulations, what types are possible in these residency programs? Standardized patients, mannequin-based sims, part task trainers, computer-based sims, whatever. You would just simply be documenting what people are doing. And I think this falls under the category, by the way, of a case study approach, that the hospital is a case study in the use of simulations for core competencies and milestones. And this might go into your literature review. This is how you kind of build a case. First, define what a competency is. It's a defined level of competence in a particular job or academic program. A core competency is a fundamental knowledge, ability, or expertise in a specific subject area or skill set. Here we're talking about residents, and here are the ACGME core competencies as we've discussed. So the core competencies are general. The milestones get into more specific sub-competencies that would fall under, for example, interpersonal and communication skills. And I'm going to send you a few files that I found that might be relevant to your project. But what's a milestone? It might be helpful to define this in your lit review. What is a milestone? Um, General definition: skill and knowledge-based developments that are commonly occur over a specific time. I'm sending you this file so you can look through this and see how they build their case here. I think I had sent you this yesterday. So for example, how core competencies kind of develop into milestones. The University of Maryland Medical Center, I think it nicely lays out their residency program. And so for example, they list the interpersonal skills and communication competence. And you'll see on the bullet points some examples of what could be turned into milestones, depending upon the residency. And here, just looking at radiology and the core competency of interpersonal and communication skills, as we read this table across, it shows what would be expected in of a milestone, that is getting your merit badge for PGY1, PGY2 and 3, and so forth. And you'll just notice that the skills get more and more sophisticated, as you move up. So I guess one thing that I would suggest is, and we can talk about this, sending out a survey to the residency programs at your place, and to simply find out, and you'd want to do this as a survey so you can collect this as a document. Do you use patient simulations in your program to teach and assess clinical skills? Yes or no? And if the answer is yes, then the next step would be check off the types of simulations that you use. And you can go back to that slide where I showed the different examples. And that might be it. And then I would just simply focus my study on those programs that are using simulations, and it might eliminate half or more of the residency program, so you don't get too bogged down. But you can include in a chart, in a table like we talked about yesterday, what programs are not using simulations, and perhaps some discussion of where they might be appropriate. So there isn't a great deal often between, let's say, family medicine and internal medicine. You may find that in family medicine, they use standardized patients, to teach and assess how to work with individual patients or families, but that standardized patients are not used in internal medicine, where it's very similar. Often it's one-on-one doctor-patient care. So in other words, you could find out what's being done in one department and what could be done in another. Anyway, I hope this makes sense, and look forward to talking with you soon.